Will the Committee of Supply please come to order? This section of the Committee of Supply will now consider the estimates of the Department of Seniors and Long-Term Care. Does the Honourable Minister have an opening statement?
I would invite members of my staff.
Do you have an opening statement first?
Yes, I do.
Okay, Minister, go ahead.
Thank you. On behalf of the Department of Seniors and Long-Term Care, I am very pleased to present the financial estimates for the 2023-24 fiscal year. The Department of Seniors and Long-Term Care was established in January 2022 to provide stewardship over the implementation of the Stevenson Review recommendations, as well as implementation of a renewed senior strategy so that aging Manitobans are able to stay safe in their own homes and communities for as long as they choose to do so. We are committed to continued implementation of the 17 recommendations identified in the External Government Commissioned Review led by Dr. Lynn Stevenson in 2021. We are proud to say that 10 out of the 17 recommendations have already been implemented. The recommendations include, but are not limited to, ensuring that staffing levels and services provided are appropriate to the complexity of the current and future residents of personal care homes, and reviewing and streamlining the licensing standards for personal care homes to ensure currency and applicability to the changing needs of residents. We are also committed to the implementation of our new senior strategy, which was released in February 2023, Manitoba, a great place to age, provincial senior strategy. This strategy is a guide for the Manitoba government to address the challenges faced by some older adults, their families, and their caregivers. It will support all Manitobans in their aging journeys and will value the significant contributions older adults have made to continue to make our province great. The proposed 2023-24 core budget for seniors and long-term care reflects an expenditure of $93.3 million and a 15 staff years FTE. This represents a $38.9 million increase from the restrated 2022-2023 budget, or a 71.7% increase. The summary budget is set, as I indicated, at $93.3 million. This year's budget includes investments in the following: $23 million for the continued implementation of the recommendations of the Stevenson Review in the following key areas: enhancement of infection prevention and control, including increased housekeeping, staffing, to be better prepared for any disease outbreaks within the long-term care sector. Increased allied health staffing within personal care homes, including additional occupational therapists, physiotherapists, rehab aides, dietitians, social workers, and recreational therapists. Increased direct care staffing within personal care homes, including healthcare aides, registered nurses, and licensed practical nurses. Enhanced information and communication capabilities to better manage human resource staffing issues before they become critical. Enhanced internet access for personal care homes in rural and northern locations, and increased emergency management staffing. This investment results in a total budget of $55.1 million for the initiatives stemming from the Stevenson Review initiatives. $15.9 million increase to support the implementation of the senior strategy, resulting in a total budget of $35.8 million for new and expanded care options for seniors in their communities, empowering them to remain in their homes and communities longer. Excuse me. This includes support for the following programs across the province: healthcare aids to support seniors in Manitoba with household incomes of under $80,000. Rainbow Resource Centers over the Rainbow programs for seniors who identify as 2SLGBTQ+, self and family managed care, palliative care services, support services to seniors, expanding age-friendly communities, support for elder abuse services, support to the Alzheimer's Society of Manitoba's First Link program. In closing, I would like to acknowledge my appreciation for the initiatives my colleagues in health has taken, such as the $200 million investment into Health Human Resources Action Plan, which will help us achieve the goal of hiring 2,000 healthcare staff. I would also like to acknowledge that the Seniors Long-Term Care Department will be implementing a new position serving an advocacy function, which will serve both as an investigative function as well as an advocacy function reporting directly to the minister. I thank you very much for the opportunity to say a few words on this year's estimates, Mr. Chairman. I would also like to acknowledge my colleagues in health for their partnership and support in this important work, as well as the many civil servants involved in this policy, planning, and related decision-making for the proposed budget. I would now be happy to answer any questions that you may have, and look forward to calling my staff and introducing them.
Thank you very much. We thank the minister for those comments. Does the critic from the official opposition have an opening statement?
Thank you, Mr. Chair.
The MLA for Elmwood.
I'd like to congratulate the new minister, and I know he's got a very tough job in front of him because his job is to try to change the channel when the past history of the government for the last few years has been disastrous, totally disastrous. So I can appreciate what they're trying to do here, but I'm just saying to you that it's going to take quite a long time to do that. For example, back in 2016, the new PC government, actually before they became the government, promised to build 1,200 new personal care homes in Manitoba, and today evidently we have 200 fewer beds than when they took office. And so their record is actually negative. It's a negative record and that was 2016. For example, when the pandemic started, we could see the pandemic spreading from, the cruise ships in the south up through the nursing homes and the seniors' homes in the United States on the border. And it took quite a long time to actually get to Manitoba. Matter of fact, the first wave practically passed us by. We had fewer, I think, than 100 cases in Manitoba. But other parts of the country were, New York, for example, had a huge crisis there. And, I kept thinking, watching TV like everybody else, that somebody was in charge of something here, that there at least had to be like one person that would do an inventory of the homes and the staffing to make sure that we were in a good place. And that apparently did not happen. How we had so many people die in Maples is just beyond comprehension. And Parkview. So we learned a lot, or the government should learn a lot of lessons out of this whole experience. And I think the lessons are that we shouldn't be building any more high-rise centers, that they should be like that they're doing in Holland and in other parts of the world, building low-profile structures. And that's why I'm very interested during these estimates to find out just where the minister plans to build his next building, because he's alluded to building new buildings, but I haven't heard one announcement as to where the first one's going to be. I'm interested in that first one. I'm not really too concerned about how many there are. I just want to see what your next one is going to be. That you're not following this failed road of what happened here. And we haven't had a pandemic for, 100 years. And 100 years ago, people were living on farms and, you didn't have a situation here like we have here since the 1960s where we built all these seniors' homes and basically served up these seniors to the virus, buffet style. We can't do that for the future. We don't know when the next pandemic is actually going to present itself. So the minister government may not have as much time as they might think in this, on this issue. So I'm interested in knowing what their path forward is in terms of actual construction, actual buildings, and what they're going to look like. If you're just going to build them like the old ones that have been here since the 60s, we found that isn't really very smart. And I know of one building in my area where the elevators stopped to work and they had to get parts from Germany, and the seniors were all on the top floor and the families were all on the bottom floors, and the elevators broke down for a few weeks. So, looking forward, we wouldn't be looking at it the same way that we were in 1960. We were just happy to have some buildings in 1960, putting 4 people in a room, right? But it's different times now. And so the different times call for a better approach to it, and I think it's lower profile buildings, and I think it's single rooms and stuff, and I haven't really heard the minister talk about this part of it. The only thing I've heard so far is we're going to get control of this situation here. Yes, there's an election coming in a few weeks. Is it basically just to get past the election, or the minister think he's going to actually be building something? And I hope he, would try to find that out, whether we're actually going to be constructing anything in the near future. So I have I don't know how much time I have left on the introduction.
4 minutes.
I'm 4.5? Okay. Well, recently we had a situation where a resident of Elmwood, Eric DeShepper, and his partner Catherine Ellis were very frustrated by the broken system, that they went to the media, and she had level 4 pancreatic cancer, and she came home for palliative care, and the care didn't arrive until 3 days after she had died. And I can tell you that's not the first time this has happened. It's happened before. Okay, the first time I've read about it in the newspaper. But there's a lot of work that has to be done here, and I don't know whether the minister has enough time to do it. Anyway, I'm ready to move on to the questions.
And we thank the member for that opening statement. So under Manitoba practice, debate on the minister's salary is the last item considered for the department in the Committee of Supply. Accordingly, we shall now defer consideration of line item 34.1A contained in Resolution 34.1. Yeah, that's part of it. That's what we're doing. Yeah, it's automatic. So at this time, we would invite the minister's staff to join us at the table, and I would ask that the minister please introduce the staff in attendance. Minister.
Much, Mr. Chairman. I would introduce Bernadette Proyne, my Deputy Minister of Seniors and Long-Term Care. Sandra Henault, who is the Assistant Deputy Minister and Executive Financial Officer from Manitoba. Larissa Gobert, who is the Senior Project Manager for Policy and Planning, Secretariat. And Mr. Doug Natton, who is my Special Assistant in Seniors Long-Term Care.
Thank you for that, and we welcome you to the table. According to our Rule 78, Section 16, during the consideration of departmental estimates, questioning for each department shall proceed in a global manner, with questions put separately on all resolutions once the official opposition critic indicates that questioning has concluded. Therefore, the floor is now open for questions. MLA for Elmwood.
Well, Thank you, Mr. Chair. Can the minister undertake to provide us a list of all the technical appointments to the department, including the names and the titles?
The Honourable Minister.
Thank you, Mr. Chair. I have two technical staff, my special assistant, Doug Natton, and my executive assistant, Andreas Contaneous.
The member from Elmwood.
Thank you, Mr. Chair. Can the minister undertake to give an organizational chart that lists all employees and program areas?
The Honourable Minister.
Thank you, Mr. Chair. I'll take that question as notice. I don't have that particular chart with us, but we obviously do have one, and I will forward it to the member.
The MLA for Elmwood.
Mr. Chair, can the minister give a list of all current vacancies in the department by program area?
The Honourable Minister.
Thank you, Mr. Chair. We are proceeding to find that information for the member. Once we have got it, then I will certainly relay it, but I won't take up too much time while the search is going on right now. So if that's acceptable to the member, then we can proceed further.
Thank you, Mr. Chair.
The MLA for Elmwood.
Thank you, Mr. Chair. It would be acceptable, but I'd like an idea as to whether it's going to be coming here in the next day, by tomorrow, or a month or two from now. What? What? Well, I
The
give you-
Honourable Minister.
That's the efficiency of my staff.
The MLA for Elmwood.
Thank you, Mr. Chair. Also, I'd like to ask some questions here in the home care field. We've asked him to explain why his department is failing when it comes to the demands being placed on the home care program. And he would know that we had documents from a response to a FIFA request that shows monthly home care staff vacancies continue to be a problem. The last data they provided shows that 1 in 5 positions, or 20%, are vacant. So the question is, what specifically is the minister's plan to fill these positions and reduce the vacancies so the home care clients are getting the supports they need?
The Honourable Minister.
Well, thank you, Mr. Chairman. And I would disagree with the member that this department is failing its responsibilities to address the needs of seniors in Manitoba. Quite the contrary. We have taken a number of initiatives, and certainly our budget reflects the initiatives that we are taking to support the people of Manitoba. I would indicate to the member that he is correct that there has been some challenges in regards to home care satisfaction. However, we are striving to address those staffing issues, and we'll continue to do that.
MLA from Elmwood.
Well, thank you, Mr. Chair. Well, that's not really a very good answer, because I just previously outlined the situation with Eric DeShepper and his partner Catherine Ellis, who are constituents of mine, and she had level 4 pancreatic cancer, and she was promised home care, this was over a number of months. This didn't happen just, she was stage 4 in November and passed away just recently, I guess February 22nd. But after, passed away 3 days before any home care arrived. Like, how does the minister explain that? How you could go from November, and all that time till February 22nd, and then show up with the home care and the supplies 3 days after the person's passed away. How does that happen?
The Honourable Minister.
Thank you, Mr. Chairman, and I am certainly familiar with the Mrs. DeSepper's tragedy, and that's what it was. And certainly our government doesn't condone a situation and circumstances that took place. When learning of this particular issue, my department, working with the Department of Health, did do an investigation into the circumstances that did exist with this initiative and or with this problem, and we are certainly addressing that issue. As I mentioned, that situation was unacceptable, and we understand that action needs to be taken to ensure that these situations don't occur. That's why there was an investigation that took place with the WRHA, and there's, in my view, that situation was addressed. I know that the WRHA officials had addressed the situation with Mr. DeSheppers after his concerns were raised. And as a matter of fact, I have correspondence from Mr. DeSheppers that had indicated to the staff how satisfied he was with the study and diligence that was done to try to address his concerns.
The member from Elmwood.
Thank you, Mr. Chair, but this is way after the fact. Like, how does it happen that a person gets diagnosed with stage 4 pancreatic cancer? That's the worst. Pancreatic cancer in November. And 3 months later, the person passes away, and then the home care shows up. Clearly, something went wrong here. Has anybody been disciplined for this? Or do we just, like, pretend that it's, it's past and we go on and hope it doesn't happen again? Is that what we're relying on here? Or did the minister actually, was anybody disciplined over this?
The Honourable Minister.
Thank you, Mr. Chairman. Well, under these circumstances, you have to rely on your management to deal with these tragic circumstances. And when this situation did occur, the WRHA management did certainly do its diligence to investigate and address the issues. I, as minister, don't have direct management over the individuals who potentially needed to be addressed. I rely on the management that we put in place to be able to address those issues. In this particular case, this fell under the authority of the WRHA and the Ministry of Health, and it's my perspective that it was dealt with through that management structure.
The member from Elmwood?
Well, this is not the first time that this has actually happened. I've got names and times and whatnot where the exact same situation happened before, where the person had cancer and the hospital bed got delivered literally the day after the person died, you know, so I don't know what happened at that time, like whether anybody was disciplined. It's hard to talk to somebody. They're very emotional when this happens, you know. And, but I don't know what sort of a system you can put in place. I know today we have the electronic medical records is way more than, you know, it's in place in many more areas than it was before. You know, I just wonder, is there a way to have a system where you can, when the doctors prescribe the home care, that it's locked into a system and it's not forgotten, and the home care gets sent out?
The Honourable Minister.
Well, thank you, Madam, or Mr. Chairman, and when you're getting into the specifics of someone's medical circumstances, that really is not, ministers and politicians aren't privy to that type of information, nor should they be. You're asking whether or not the system is able to address those particular issues, and I had indicated to the member that the WRHA, the authorities, all the health authorities, have mechanisms in place to be able to address these issues. And it's the minister's responsibility to ensure that these situations, when they come up, unfortunately, they do come up periodically, are addressed to try to prevent further problems, and that's exactly what we do.
Member from Elmwood.
Well, thank you, Mr. Chair. The point here is that we don't precisely know what went wrong in each of these two cases, do we? I mean, somebody has to find out at where did the actual mistake happen. You know, when there's a railway, a train crash, they do a inquiry to find out and reconstruct exactly what happened, to find out just what happened, with the idea that you're going to improve the safety, that you're going to maybe have a mechanical problem or a problem with the person. I mean, that's what you have to find out. And those recommendations are made public at a certain point, and changes are made, and the railway is made safer, and the problem doesn't repeat itself. But here you have two examples, actually both of them are my constituents, where the same sort of situation is here. And nobody's been able to point out what the actual problem was in either one of these cases right now. Like, what could have made this? It went on 3 months. So, for cover here, or is that what sort of happened, and they cover things up? And
The Honourable Minister.
Thank you, Mr. Chairman. I would challenge the member who's indicating that our healthcare professionals are running for cover. We have a very, very capable healthcare system with very, very dedicated and compassionate and passionate individuals. So to suggest that those particular individuals are not prepared to do their job and do due diligence to this type of thing, frankly, is not really acceptable. Again, I come back to the same position that the health authorities investigate these situations, and based on their investigations, they take the appropriate actions and try to ensure within their processes that these type of situations don't reoccur. Again, our government, nobody in this room would condone a situation like that exists, and to suggest that our health professionals wouldn't do their due diligence to ensure that these type of situations don't exist and just throw it under the table is totally inappropriate and not accurate.
Member from Elmwood.
Thank you, Mr. Chair. So I'd like to ask the minister then, what is the current vacancy rate then in staff positions with home care today? Like, where are we at with vacancy rates at the moment?
The Honourable Minister.
Thank you, Mr. Chair. I would have to take that question under advisement. The particular numbers that the member is asking for, we would have to get through the Department of Health. And in order to get the member the accurate information that he is seeking, we would have to do further due diligence with the department and reply to him once we're able to achieve those numbers.
Member from Elmwood.
Thank you. So can the minister give us an idea as to when we should be getting that information?
The Honourable Minister.
Thank you, Mr. Chair. My department works very, very closely with the Department of Health, and I'm advised that we should be able to supply, I say should be able to supply, that information by the end of the week. That is our intent. If we have to go into the next week based on circumstances, I can assure the member that we will find the information for him in reasonable time.
Excuse, I need to just acknowledge you first, sir. So the member from Elmwood.
Mr. Chair. So could you ask them then, in addition to finding out what the vacancy rates are, say, today, can you give us a trend line as to whether we can see, where we're seeing improvements, right? So if they can say, well, the vacancy rate is such and such on April 1st, then, you know, which way is it going here? Is it improving or is it getting worse? That's what I'd like to see anyway. So maybe if you could graph it from January, right? Maybe, right? Try that. Yeah.
The Honourable Minister.
Thank you, Mr. Chair, and I would indicate to the member that our department is committed to satisfying his request, and with the information that we're able to supply, I'm sure that he has the experience and the ability to analyze and determine what those trends may be. So I have every confidence in the member's abilities.
The member from Elmwood.
Thank you, Mr. Chair. So with that in mind then, I'd like to know specifically what the minister's plan is to fill all these positions, these vacant positions, and reduce these vacancies so that all of the clients who are getting the supports that they need. So does he have any specific plans here to get this vacancy down to 0 and keep it there? I guess.
The Honourable Minister.
Well, thank you very much, Mr. Chair, and I would indicate to the member that this government has taken a number of initiatives to ensure that we are addressing the needs of seniors. In particular, the department has increased its overall budget to this department by 71.3%, I believe. And a lot of the initiatives, or all the initiatives, are going into enhancing seniors' experience in Manitoba. Currently, there are 50,000 seniors that are being served by the home care program, and that relates to an investment of this government by over $300 million to home care annually. That initiative and that contribution to ensuring home care is continually supported, I think, speaks for itself. As a matter of fact, at the end of this fiscal year, our government has increased the home care funding by 3.66%, which again speaks loudly to our commitment to home care. We are certainly looking to take initiatives through a number of issues. I know most recently the Winnipeg Regional Health Authority was on a very aggressive recruiting program to hire 50 individuals non-certified initially. And the goal again was to have 200 more by the end of June, with ultimately the goal being at the end of the year to have 500 additional recruitments. So we are certainly working very diligently to address the issue of staffing and support home care in a number of different areas, and we will continue to do that.
Member from Elmwood.
Well, thank you, Mr. Chair. Well, you know, what the minister says, makes sense and would make more sense if there wasn't a past history with this government. I guess that's really the conundrum here. That if you could forget the last 6 years, when Brian Pallister was elected premier the first time, it's a totally different looking government right now, or at least talking government. That's what they're trying to do here. But the public, I don't think, have gotten onto this newfound approach yet, because they remember all those years, those 6 years where, this wasn't your priority. So forgive me if I, want to ask you a few more questions here because of that. if the government had been paying attention to this issue, home care and building more of the buildings and so on, have they been in tune with this issue for the last 6 years, we probably wouldn't be, totally skeptical of what the government is doing right now. I think a lot of people think that what you're trying to do is just get past the next few months. And this has happened before, probably with you guys too. But it's a believability issue. And so you say you're going to do this, and then people just want to know that it's real, that it's actually going to happen. And I think, that what you want to be doing here, if you're going to build a senior's home, or if you're going to do one of these long-term care homes, that you actually announce a real project, so we can see it. And well, there's a new one that you want to make that's, yeah, I want to see that. But I can tell you that in, for example, the Highway 59 issue, right, of the Cloverleaf up there and expansion, we didn't think the public was going to believe us if we just simply announced it again. So we made sure, some of us made sure, that there was actual graders and work being done there, like right away. Okay? And it proved out to be a good project. But did we even believe it ourselves? Because it's been promised so many times before, And governments have a tendency to do that. The Conservatives in Brandon announced that hospital in Brandon, probably, I don't know how many times over about 10 years, became a point where people actually wouldn't believe that you're actually going to do it when you just keep re-announcing it. That's what the issue is here, right? So I just want to know, like, when am I going to find out when this next PCH is going to be built? You were supposed to build one in Lac du Bonnet. That was a big issue for quite a few years here while he's now a minister, but he was a critic before, was complaining about the PCH home being built in Lac du Bonnet, and then all of a sudden, it just disappeared. It just appeared in thin air, gone. What happened? What happened to that home, and where is it now? Like, why are you not building it as we speak? Because it was a promise.
The Honourable Minister.
Thank you, Mr. Chair, and certainly the member brings up likes to bring up a great deal of history. I mean, the previous government that he represented was thrown out by the people of Manitoba who understood that there needed to be change in this province, and initially in 2016 gave this government one of the highest majorities in the history of the province, if not the highest. And then in 2019, after this government had an opportunity to continue to show the people of Manitoba how it was going to proceed and progress, the people of Manitoba, with their wisdom, determined in 2019 that would also give this government a very substantial, second highest, and doubling, I think, what the New Democratic Party, the Members' Party, had. So I think that if you're looking at the perception of what the public feels about governments, I think there is a history of certainly of what the people's preference was in regards to governments doing their job. Now, the member does indicate, I think the member jumped around here a little bit. We were talking about home care, and now we're talking about PCHs. So So I'm very happy to, if the member wants to shift gears to personal care homes, I'm very comfortable in doing that. As I mentioned, our home care initiatives, before I leave that particular component, this government is working very diligently not only to establish further aging in home initiatives, such as the self and family managed program, which we have initiated, and we also, too, have indicated several times in the House that there are more initiatives coming forward out of the senior strategy, and I can assure the member that they are coming forward. And innovative initiatives, not just the standard status quo initiatives that are well thought out and a lot of due diligence done to look to the how the people of Manitoba, seniors of Manitoba, are going to be able to enjoy their aging. Now back to the personal care homes that the member now brings forward, is that the member is correct. This government is very interested in fulfilling the needs of Manitobans when it comes to personal care homes. And again, we will be announcing in the very near future our government's plans to fulfill those needs. And I can indicate to the member, if he's taken the time to read the senior strategy, which does, I think, very aggressively indicate that this government is very supportive of the concept of Seniors Village or Seniors Campus. And I can assure the member that the initiatives that we are bringing forward do address that particular concept and that initiative. The member does bring up that there are different models in different areas, and I can assure the member that myself, with my department, with the stakeholders of Manitoba, have reviewed a number of different areas different models that we feel that we can adapt going forward. And also, too, there's more than just focusing on the traditional personal care home that can satisfy needs of Manitobans as they age. And as we proceed with further initiatives to be able to address the needs of those individuals who need personal care homes, we will also be announcing other very innovative and progressive initiatives that will also address it. So I'm sure the member will be sitting on the edge of his seat waiting for these announcements to come forward, and I certainly look forward to presenting them.
Member from Elmwood.
Well, thank you, Mr. Chair, and I'll be pleasantly surprised when I see it, optimistic when I see it. Yeah, I know I want to see it done. So that when the next pandemic comes, hopefully it never comes, but there will be on some day that we will not have, whatever government's in power at the time, that we will not have this terrible situation on our hands. It was totally, I wouldn't say it's totally impossible that it can't happen again, but we should do whatever we can to make certain that it doesn't. Now, yeah, I have a question here about the data showing that the number of, back to home care here, the number of home care clients helped was down by over 1,000, and the number of hours of care is down by over 250,000 hours, close to it's about a 10% decline. Does the minister acknowledge that the staff vacancies are the main barrier here to increasing hours of care for an increasing number of patients and making up for the cuts they made to the total hours of care?
The Honourable Minister.
So just for clarification with the member, we are talking about personal care homes right now, staffing, or are we talking about home care staffing?
Member from Elmwood.
We're talking about home care staffing. I did say that.
The Honourable Minister.
Thank you, Mr. Chairman. In order to ensure that the member has the most accurate data on that particular question, I would, again, administration feels that they can give me some information right now, but it doesn't really include all the information that the member's asking for. So therefore, if it's accommodates the member, we will, with the other information that we are providing him, we will provide you with that too. We're looking, pardon me?
By the end of this.
As I'd indicated previous, we will be supplying you the information. It's our intention to get it to you by the end of the week, if not the beginning of next week. So therefore, I can assure you that you'll be getting it in real time.
Member from Elmwood.
Thank you, Mr. Chair. Is the minister concerned that certain health support staff have still not received retroactive pay for the negotiated wages they agreed to last year I guess 7 months ago? So there's an issue with retroactive pay. Has that been worked out?
The Honourable Minister.
Thank you, Mr. Chair. You know, I'm not in a position to be able to answer the question in regards to how the contractual arrangements between our employees and the departments are carried out. So on that particular issue, it's my expectation that all negotiations continue to be done very, very positively, and both parties are able to come to reasonable conclusions under the traditional contract negotiations. And therefore, I'm really not in a position where I can indicate to the member one way or another on satisfaction or dissatisfaction in regards to negotiated contracts.
Member from Elmwood.
Thank you, Mr. Chair. Now we're going to flip back to personal care homes. Okay, just follow that bouncing ball. Yeah. Oh, yeah. Does the minister believe that the standard of care within Manitoba's personal care homes is adequate?
The Honourable Minister.
Thank you, Mr. Chair. I can indicate to the member that the criteria of personal care homes is actually legislated, and it is our expectation as a government, not our expectation, our demand as a government, that that legislation is followed by those caregivers. And I would indicate that it is our intention to ensure that all of those different entities fulfill their obligations through the legislation.
The member from Elmwood.
Thank you, Mr. Chair. What percentage of the Stevenson Review recommendations have been implemented so far?
The Honourable Minister.
I can advise the member that the Stevenson recommendations, as we've publicly stated, out of the 17 recommendations, 10 of those recommendations have been implemented, and the other 7 are in the process of being implemented.
The member from Elmwood.
Thank you, Mr. Chair. And so what's the timeline for the remaining 7 to be implemented?
The Honourable Minister.
Thank you, Mr. Chair, and the initiatives that are proceeding are all underway. I can indicate that to the member with a great deal of confidence. I can indicate to the member that when the Stevenson Review was brought forward, our position and guarantee may be strong, but certainly our position to the public is that we would be implementing within a 6-year time frame. So we're in the based on that 6-year, we're into the 2nd year now. So in answer to the member's question, I can indicate that we are looking to have all of the recommendations of the Stevenson report implemented within the 6-year time frame that we initially put forward. If we can get the initiatives satisfied before the end of that 6-year time frame, then obviously we will do that. We're working towards achieving those goals as soon as we can, but we indicated a 6-year time frame, and that was 2 years ago.
The member from Elmwood.
Thank you, Mr. Chair. Does the minister think that there's enough PCH beds in Manitoba at the current time?
Honourable Minister.
Thank you, Mr. Chair. As I think I'd indicated earlier in or answered the member's question earlier, was that this department will be bringing forward further recommendations on personal care home beds initiatives, and also over and above the personal care home bed initiatives, other very innovative initiatives to satisfy care beds in the province of Manitoba. So the only way that I can answer that question is to say that the government is taking an initiative to further add personal care homes to Manitoba.
The Honourable Member from Elmwood.
Well, thank you, Mr. Chair. As I said before, in 2016, the PC party campaigned on a promise to build 1,200 PCH beds. So can the minister explain whether his government has followed through on this promise?
The Honourable Minister.
Thank you, Mr. Chair, and as I'd indicated to the member, it is the government's intention to increase personal care home beds as well as other innovations to ensure that we will fulfill the needs of Manitobans. And I had indicated to the member, basically, stay tuned. I'm sure that the member will be extremely supportive of the initiatives that the government is going to be bringing forward to ensure that the needs of Manitoba seniors are fulfilled. So, I mean, I'm not sure how better to answer that question.
Member from Elmwood.
Thank you, Mr. Chair. Well, the fact of the matter is that the government has not followed through on this promise of 1,200 PCH beds. I don't know how he expects the public of Manitoba to believe this year, if he makes a similar announcement that he's going to build another 1,200 PCH beds, and 6 years ago he made the same announcement, the party made the same announcement and didn't follow through on him, what credibility is it going to have going forward with the public when you didn't fulfill your first promise of 1,200 PCH beds? I'm just saying that it's probably going to be seen as an empty promise if that's what you're doing, is making a promise that we're going to do another 1,200. We didn't do them in the last 6 years, so we're going to do them in the next 6 years. So the answer to that question is no, you've not done 1,200, built 1,200 PCH beds. Now, not only have they failed to follow through with their 2016 promise within 2 terms, there's actually fewer PCH beds in Manitoba today than when they took office in 2016. There were 9,698 in the province in beds in 2016, and there's 9,549 now. Can the minister explain why his government broke their promise to Manitobans?
The Honourable Minister.
Thank you, Mr. Chair, and I wouldn't agree with the member indicating that this government isn't following through on commitments to ensure that the seniors of Manitoba's needs are being met. I think that many of the initiatives that this government has taken place in regards to supporting seniors are quite apparent. The senior strategy that was brought forward has a number of different announcements that were brought forward to assisting the people of Manitoba. One of the most recent ones, which I can tell you was very well accepted, was the hearing aid initiative that this government brought forward to support seniors. So much so that they were all seniors were very interested to see what the opposition was going to do in regards to supporting this initiative, so that we could get going on this and they could receive that type of support. But and certainly not all of the other initiatives that are coming out of the senior strategy, which I've identified, which I could walk through, which I enjoy walking through in the House, actually. But let's talk about a little bit more of the member's concern in regards to personal care homes. I can indicate, and I've indicated publicly in the House, this shouldn't come as any surprise to the member, that this government is in planning and design for a number of increased personal care home beds or personal care beds to the province of Manitoba. So being in planning and design is a very substantial step to continuing to fulfill the obligation of, the member continues to say 1,200. It is my expectation that after we bring forward our initiatives, that we will surpass that, which is something that no other government has been able to accomplish, but our government certainly is looking towards fulfilling that goal. And as I mentioned, we are proceeding in planning and design on these initiatives, as well as other initiatives too, which I will identify. So I look forward to bringing that to the member's attention.
Member from Elmwood.
Thank you, Mr. Chair. The PC government canceled PCH projects in Lac Du Bonnet and Bridgewater. Can the minister explain why, and was this the correct decision?
The Honourable Minister.
I can indicate again to the member that this government is in planning and design of a number of different initiatives that will be brought forward to not only reach the 1,200 beds that he continues to reference, but actually surpassing that. So I'm very confident and very optimistic and very enthusiastic about the support that my government has given this department to be able to proceed and fulfill its needs, its perceived, or its the needs that it believes will fulfill the needs of Manitoba seniors. So look forward to it.
Member from Elmwood.
Thank you, Mr. Chair. Well, I distinctly remember the member for Lac Du Bonnet for at least a couple terms as he was an MLA, talking about building the PCH project in Lac Du Bonnet. And then when the Conservatives formed the government, this was not done. Why?
The Honourable Minister.
Thank you, Mr. Chair. And we do our due diligence when we determine how we're going to proceed to fulfill the needs of seniors in Manitoba and overall population of Manitoba. We take advice from the health authorities, the professionals who are assessing the needs of Manitobans, and we proceed accordingly. Again, I would say to the member that we will be proceeding. We're in planning and design of a number of different facilities, as well as other initiatives, to fulfill that initiative of care beds. And it's my hope or my expectation that the member will support this when they come forward. I've heard many times the Leader of the Opposition indicate what his support for increased personal care home beds in Manitoba. And I indicated to the Leader of the Opposition when he was speaking to it in the House once that I would look forward to his support on these initiatives. Just like when we bring them forward, I'm looking forward to the support of the opposition to allow us to continue to proceed with these initiatives. This is a whole government situation. This is just not our government. This is something that affects all Manitobans, including the constituents of the opposition, and therefore these positive needs are not, they should stand outside the political arena. They should go to fulfilling the needs of Manitobans. So therefore, it would be my expectation that the opposition will wholeheartedly support these initiatives brought forward by the government.
The member from Elmwood.
Thank you, Mr. Chair. The minister's referenced a couple times now that there are a number of projects, PCH projects in the planning and design stage. How many are there? And is one of them Lac du Bonnet?
The Honourable Minister.
Thank you, Mr. Chair, and as I indicated to the member, we will be bringing forward the initiatives that we are planning to take in the very near future. And the member, I'm sure, will be very interested to hear our announcement.
The member from Elmwood.
Thank you, Mr. Chair. We know that Manitoba has an aging population that will require more supports in the future, including PCH beds. And has the Minister's Department done any analysis on how many PCH beds Manitoba will need in the future?
The Honourable Minister.
Thank you, Mr. Chair, and certainly I can appreciate the member indicating that we do have an aging population and a population where the demographics are skewing towards seniors. And this is not something that's new. This is something that his previous government, quite frankly, we're seeing the same trends. We're seeing the exact same situations, and they did not act on it. They didn't do anything on it. I frankly when I took this position, I looked to see what type of reports or what type of information was gathered by the previous government in regards to looking at the long-term needs of Manitobans, and quite frankly, there was nothing. So this government took it upon itself to address these needs. In answer to the member's question is that we have professionals that work within the health department. We have professionals that are looking at demographics and looking at different areas of need, and we take that advice. And so members asking what type of planning was done. Well, the planning was done with a great deal of due diligence with the department. And I can also indicate that when we were developing our senior strategy, we went out and we talked to Manitobans. We talked to stakeholders, we talked to seniors, we talked to all Manitobans, and they also too presented their thoughts in helping us develop our strategies, and also too contributing to the overall needs of Manitobans. So we took into consideration a number of different areas of expertise in going forward.
Member from Elmwood.
Well, I guess, thank you, Mr. Chair. I would guess that the minister has half a dozen of these projects that he's holding up his sleeve and waiting to announce in the election that's coming up. I can just assume that that's what's going on here. Otherwise, I think he looks pretty excited that he'd want to introduce them, announce them right now and let us all know, but he's been ordered not to do it. I just don't know how the public can trust a government that promises to build 1,200 of them 6 years ago, actually not only doesn't do it, but actually reduces the number of PCH beds. And now he's going to start again. They're going to start again and say, oh, we're going to deliver another 1,200. And I just think we're looking at more broken promises, but that's just me. Maybe this time he's going to be different. In 2016, the minister would like to answer that question. Okay, sure, go right ahead. That is a question. Here.
Well,
The Honourable Minister.
Thank you. Well, I enjoy the discussion with my honourable friend. I must say that. I was actually hoping that him being and I think it's safe to say that we're both seniors, and I was always looking I was always looking forward to being my critic, to asking me some questions in the House, and we could have that back and forth. And I've enjoyed those conversations too, so I consider the member. The member indicates that these initiatives are coming forward as some type of an election strategy. When Premier Stephenson became the Premier of this province, one of the initiatives that the Premier took was to establish a Department of Seniors and Long-Term Care. She recognized that the health department is so large that there needed to be some further focus in regards to some different areas. So the Department of Seniors and Long-Term Care was established, as well as mental health and community wellness. So the Premier determined at that time, which was considerably earlier than the member is indicating right now as far as timing of announcements, to address the needs of seniors. And that's what this department has been working towards. So we've been working on a senior strategy for a number of time now, and we've announced certainly several initiatives that has come out of that based on the senior strategy, as well as the implementation of the Stevenson report. So I would indicate to the member that his commentary is not accurate. We've been planning to support seniors ever since Premier Stephenson has created this focus in these departments. So this is really not an election issue. This is a government issue that we recognized seniors' needs needed to be addressed based on the demographics that took place. And as I mentioned, I come back to what the member had indicated previously in regards to history. The former government, as far as I could see, I looked around for a number of different reports, etc., that the government did to address the increase in seniors' population, the explosion once the baby boomers were hitting the seniors' age grouping, and I couldn't find anything. So, I mean, this trend is nothing new, but our government determined that obviously we had to address it, and we are. So the initiatives we're taking don't have anything to do with the election. They have everything to do with fulfilling the needs of Manitobans.
Thank you for that. And just before I recognize you for the next question, just a quick reminder that when you're referring to other members of the House, it's by position or title, not with their name, please. And I will now call on the member from Elmwood.
Thank you, Mr. Chair. And before we move on to another question, though, I just wanted to finish off by saying that 2016 was an election year, right? And the PCs promised to build 1,200 PCH beds within 2 terms. And we never heard anything about that anymore. We didn't hear anything about PCH beds for the next number of years, so they broke that promise. Now they've announced, just before an election, we're gonna build a new PCH in Winnipeg. First time they've raised the idea since 2019. And what do these 2 years have in common? Well, they're election years. So, I mean, he can say all he wants that they've been lying awake at nights for every single day in the last 6 years, conspiring to build things that they didn't build. They just promised in 2016 these 1,200 beds, and then what happened? Nothing happened. And then the next election came up, once again, nothing happened. So having said that, I want to move on to my next area here, which is patient transfer. Want to ask the minister, does he believe that seniors should have access to personal care homes close to home? Because we have instances now where we've got patients being transferred, I don't know, 100 miles or 100 kilometers from their homes. That's just not right. So I'd like to get your comments on that, Mr. Minister.
The Honourable Minister.
Well, thank you, Mr. Chairman. And just before I go to the next topic of the member, before we leave personal care homes initiatives, our government will continue to fulfill the needs of seniors, and that's exactly why we're in planning and design, as well as other innovative initiatives to fulfill those needs. And I would remind the member that on many occasions I heard your leader indicate that he was in support of personal care home beds for the province of Manitoba. And it would be my perspective that the member support his leader in supporting our initiatives to further create further supports for the people of Manitoba. Now, back to the next line of questioning that the member has brought forward in regards to transport of fulfilling seniors' needs in regards to location and areas of more convenient. I think it's fair to say that. Certainly, this department is very supportive of trying to satisfy the needs of any individuals who are wanting to stay closer to their communities and closer to their families. I mean, that's something that is certainly a priority when circumstances do exist under the very difficult circumstances that all governments had to contend with during COVID. There were some very difficult decisions that had to be made. I was, or our department, I think in this particular instance, we're more relying on the expertise of our health professionals to recommend the most appropriate initiatives to ensure that the care of the individuals required were taken. So I know that our Department of Health was the authority in regards to determining these initiatives and these transfers through advice of professionals, and I would defer to their expertise. In answer to your question, do I believe that it would be best to try to keep seniors closer to home? Well, of course. I mean, don't think anybody would indicate that wouldn't be a priority, but ultimately, the needs of the health of seniors has to be considered first and foremost.
The member for Elmwood.
Mr. Chair. Well, I'm looking for the members' comments, I guess, on examples that we have. Like, we have a case here covered in the Roblin Review regarding a 90-year-old woman who was literally ripped from the only community she's ever known and placed in a personal care home in Shoal Lake, where she has no family or friends. And so there's more examples like this. So I don't know where there's medical evidence that it's a smart idea to take somebody and move them 100 miles from their community and then make it tougher for their loved ones to come and see them. Like, does that make any sense? I'm sure that nobody around this table would agree that that's a good idea, but these things are happening. And of course, you're the minister, so it falls on you to find out why this is happening and what are we going to do about it.
Honorable Minister.
Thank you, Mr. Chair. Well, first and foremost, I'm really not going to get into the detail or comment on a specific case that may being dealt with, through the health authorities. I mean, I don't believe this is the appropriate place to get into that. This is more of a discussion in regards to our estimates and the initiatives of the government. So, I understand that there may be some frustration in regards to some of the initiatives that are taken. I can't speak to why those initiatives are taken, because really that's really a decision that's made by the health professionals. And it's my understanding that all reasonable initiatives are taken to try to ensure that individuals are able to be kept within their community. And that's my position, and I know that's the position of the Minister of Health. But if circumstances dictate that an individual has to go to another area to satisfy their needs, then that's really a decision made by the health professionals.
Member for Elmwood.
Thank you, Mr. Chair. Can the minister explain why establishing a seniors advocate was not part of the senior strategy?
Honorable Minister. Thank you.
Thank you, Mr. Chairman, and frankly, I'm very enthusiastic about an initiative that this government is taking, or this department is taking, to expand its department to include a position of advocacy and investigation, which will further advise the minister, who actually is the seniors advocate of Manitoba. And it's the Department of Seniors and Long-Term Care has now been in existence for just over a year. And with that comes an evaluation and a determination of how our department can run even more effectively. And therefore, it's our government's initiative to add a further position to our department, which will act to further enhance the advocacy of seniors in the province of Manitoba. And Mr. Chair, I would indicate that there are several models of advocacy out there. There's just not one solution. I would note that seniors advocates in the country of Canada, there are 3 out of all of the provinces and territories. So therefore, there are other models in place that governments are pursuing to ensure that the needs of seniors are being met. I'm very proud of the initiatives that this department has taken to ensure that seniors are being advocated and initiatives are being taken to support. And frankly, the stakeholders that we deal with are very, very satisfied with the progress of this department. And sometime when we have more time, or sometimes when I'm questioned in the House, I'd be more than happy to relay all the positive and supportive comments that we have from stakeholders who also advocate on behalf of seniors. So we're working together with all of the initiatives and all the very passionate and committed people working together to establish mechanisms that are going to support seniors, and we've done that. So, in answer to your question, we do have a seniors advocacy in this province, and it's expanding.
Member from Elmwood.
Thank you, Mr. Chair. The recently released senior strategy lacked important details such as when initiatives would be implemented. For example, the initiative to develop an ageism prevention toolkit is outlined in the strategy, but there's no timeline provided to complete the toolkit. Can the minister explain why the strategy lacks clear timelines?
The Honourable Minister.
Thank you, Mr. Chairman. I think that the member is mistaken. I just announced a $4.5 million senior support initiative that addressed that particular initiative that he's referring to. So I will further ensure that I've got that information in front of me, and I will relay it further. As I mentioned, not last week, the week before, I publicly announced a $4.5 million investment to support stakeholders who are doing exactly what you're asking me. So I don't want to go there anymore.
The member from Elmwood.
Thank you, Mr. Chair. Many of the initiatives in the senior strategy also lack specifics. For example, strategy on page 28 that the government will work to support older residents and those who care for and support us to deal with the rising cost of living, yet it doesn't say how this will be accomplished. Can the minister explain why?
The Honourable Minister.
Thank you, Mr. Chair, and this government has taken a number of initiatives to support seniors. The member references affordability. We have proceeded with many initiatives. One in particular that again I mentioned earlier has resonated with the people of Manitoba. Being the hearing aid initiative, where seniors who have a household income of $80,000 and less would qualify for a $2,000 grant each member. And Mr. Chair, that initiative is so positive because not only does it affect lower income Manitobans, it addresses middle income Manitobans. And that initiative, as I mentioned, has been extremely well received. And again, once our budget passes, the opportunity for those individuals to be able to utilize that will be, I'm sure, well received. That's just one example of what this government is doing to ensure affordability and supporting. The other area that I would indicate is that this government has identified that one of the areas that is very, very significant challenge to our seniors is Alzheimer's dementia. And we have been working with our stakeholders to try to identify different ways of being able to support those individuals, those caregivers, who are faced with dealing with this very difficult disease. So, we had offered a First Link program, working with the Alzheimer's Society of Manitoba, and in doing so, that of course does address and further fulfills needs of Manitobans. So those are just examples of things that our government is proceeding to do to support not only seniors, but also to support those caregivers. As I mentioned, my announcement that I made in supporting support mechanisms such as the Manitoba Association of Seniors Communities, as well as other support groups. We've continued to do it, and that's something that we've committed to, and we will continue to proceed. Those are some of the initiatives, and there's more to come. I keep reminding the member that the senior strategy has a number of initiatives that we're bringing forward, and there's more to come.
A member from Elmwood.
Thank you, Mr. Chair. On home care strategy, the home care strategy says that the home care model in Manitoba will be redesigned. Can the minister explain what the new model is going to look like? And when are we going to see this redesigned model?
Yeah.
The Honourable Minister.
Thank you, Mr. Chair, and I am very excited about the new innovative modeling that we're bringing forward for home care. We have already initiated a $12.6 million investment into self and family managed care. And certainly that's an area that has been well received. That's what we heard. When we went to public consultations in all parts of this great province, we heard from people that they wanted to age at home. And that was quite clear. That was quite clear in Brandon. That was quite clear in the north. That was quite clear in the south. That was quite clear everywhere. And we had reacted on our initial investment announcement of a $12.6 million investment in self and family care, which allows the individuals to be more in control of how they're going to proceed within their environment. And the member asks, well, when can we expect even further? And I can tell the member that the announcement that will be coming forward to indicate more innovation to home care will be coming forward very soon. And I look forward to the member reviewing and certainly probably being as enthusiastic as I am on that, because as the member appreciates, I'm a senior, and longer term, I'm looking forward to seniors being able to utilize this type of support longer term, as I'm sure the member is also.
A member from Elmwood.
Thank you, Mr. Chair. I promised the member for River Heights 20 minutes, and we're down to 18 now, so I think we should allow the member for River Heights to use the 18 minutes.
Thank you. A member from River Heights.
Yeah. When you look at the efforts for seniors and we combine long-term care and home care, it's my understanding that of the dollars, that the allocation is about 2/3 for long-term care and about 1/3 for home care. If the minister could, confirm that and tell me whether that's the kind of balance that he's anticipating into the future.
The Honourable Minister.
So just to clarify, I want to make sure that I have the member's question clear. So you're asking whether or not the 1/3, 2/3 ratio that he indicates, and I haven't confirmed that, but he indicates is something that the government is adopting. Is that correct?
The member for River Heights.
If that's your vision of what that will be 5 or 10 years from now.
The Honourable Minister.
Thank you, Mr. Chair, and in answer to the member's question. I would indicate that that's not a government policy, 1/3, 2/3. I would indicate that we're going to have to do a little bit more number crunching to ensure that, in fact, the accuracy, I'm not suggesting that the member's trying to mislead. I just wanted to confirm the accuracy of what he is indicating in regards to, I assume you're talking about budgetary expenditures here. Right. So we'll have to further indicate what exactly that looks like and confirm it. But I can confirm to the member that there isn't a government policy that says it's 1/3, 2/3. It's just, if in fact the member is correct, then that's just the way it's shook out.
Honourable Member from River Heights.
I understand that from the ministers, from your remarks, that you're planning to and are expanding the self and family managed care program. Some funding was going to that before the allocation of the 12.6 million. I'd like to know, you've got two primary programs in a sense. One is the regular publicly funded home care delivered by people who are hired staff to do that, and the other is the family and self and family managed care. What's the current allocation between the two, and what's the plan for the years ahead?
The Honourable Minister.
Thank you, Mr. Chair, and we looked at some different scenarios here in regards to answering the member's question. However, I don't feel comfortable in answering it to the accuracy that I want to. So therefore, I would indicate to the member that we will further determine with the Department of Health the actual dollar amounts and those breakdowns and get that to the member.
Okay, the member for River Heights.
If you could get at the same time the figure and the proportions for home care versus long-term care. Right. Good. Mentioned long-term care standards and said that these were in legislation, but I suspect that they're in regulations rather than in legislation. But maybe you can tell me whether it's legislation or regulations.
The Honourable Minister.
Thank you, Mr. Chair, and I'd answer the member. I think the member's sort of right on both occasions, or both scenarios. It is regulation, but it's also within the legislation. So the regulation is within the legislation. That's what I'm advised. So when I had indicated that drawn the distinction between that particular service offered versus others, I'm very clear on indicating that there is a criteria that personal care homes have to meet based on legislation, which includes regulation. I hope I'm clear on that.
The member from River Heights.
Thank you. Now, one of the standards, which I understand has been in place, was that there was 3.6 hours per resident. And I believe the minister has indicated that he is or has moved to 3.8 hours per resident per day. Is that one of the standards, and what is the current situation with that?
The Honourable Minister.
Thank you, Mr. Chairman. And yeah, in answer to the member's question, is that I wouldn't say that that would be a standard. That would be a goal. And also, too, that comes from a national study or a national, the federal government hasn't adopted a standard, a national standard. So I want to be quite clear that this government is proceeding to establish a higher ratio. That's really not in question. That's where we're going. Whether or not we identify it as a standard or not, I guess, is a question. But in answer to the member's question, when we started further to the Stevenson Review, which the member is familiar with, one of the recommendations didn't actually indicate an actual ratio, but what did indicate that an increased ratio, our ratio, was warranted. So we were at a 3.6 to start. And right now, we are at an average of 3.7. So we've moved from 3.6 to 3.7. Our goal by the end of this year is to get to a 3.8. That is our goal. Ultimately, I've said publicly that it's the government's goal to proceed to a 4.1 within 6 years. That's challenging because of basically staff challenges. But that is the goal that we're working towards. Now, in saying that, as the member would know, the federal government is taking some initiatives in regards to this area, which I'm not privy to exactly where they're going and how they're going to implement their various policies. But if we can get this done within 6 years, we can get it done earlier to get to the 4.1, then that would be our government's ambition.
Member from River Heights.
Yeah, one of the things that's become increasingly important, as the minister knows, is the proportion of people in many long-term care homes who have Alzheimer's or other forms of dementias. Is it a standard that everybody who works in such long-term care homes have specific training in dementia and understanding dementia and the care for people with dementia?
The Honourable Minister.
Thank you, Mr. Chair, and in answer to the member's question, the criteria of the individuals who work in the healthcare system are more determined and met with the Department of Health, not the Department of Seniors. So therefore, the criteria that they have in regards to different areas of expertise, I would indicate that some of the individuals that are taking care of our elderly within personal care homes would have an understanding of how to deal with dementia, but I can't indicate that all individuals would have that expertise. That's something that we would have to deal with from the health department's perspective. I can tell you that I've had extremely good discussions and liaison with the Alzheimer's Society of Manitoba. They're great people to work with. And Aaron Crawford, as well as Wendy Shetler, have been very, very supportive and helpful to me in my understanding of this particular challenge. So they have indicated that as we continue to work with them through developing dementia communities and their advocacy on behalf of that, have indicated that they're certainly prepared to make further recommendations in how to properly address that, which could include those individuals who may not necessarily have the training in this particular area that the member references. But certainly I'm not opposed to further understanding of dealing with it.
A member from River Heights.
Yeah, I think this is fundamentally really, really important in terms of having people who understand and know how to deal with people with dementia. I've had a number of people come to me with instances where clearly that was not the case and it was a big problem. In Brian Goldman's book on kindness, he has a chapter which describes a woman by the name of Naomi Field, who has written a book called Validation Breakthrough, which talks in an interesting and helpful way about different levels of dementia and how individuals
Sorry to
with
interrupt, but the hour being 5 o'clock, committee rise.